Good afternoon and welcome to the 7th lecture of PTCB exam preparation. Last time we finished the cardiovascular system and its drugs, and we stopped at those two questions which we're going to do right now. Those two practice questions, the first one is, what drug class is used to lower cholesterol? A is ACE inhibitor, B is statins, C is beta blockers, and D is diuretics. The right answer is statins, as everything that has a statin in it, they are cholesterol lowering drugs. The second question is, which suffix identifies beta blockers? A is pril, B is sartan, C is ulol, and D is statin. The right answer here is ulol. So any medication that ends in ulol is a beta blocker, and those beta blockers are used for treatment of hypertension, treatment of arrhythmias, and treatment of heart failures too. Okay, and then we're going to start with our new system with its medication, and that system is the digestive system. Basically, so what we're going to do is we're going to talk about medications that are used to treat the digestive system, as we did with the cardiovascular system. First group of medications, they are the antacids, and antacids are indicated for the gastroesophageal reflux disease, which is the abbreviation of it is GERD. It's also used for the treatment of peptic ulcer disease, PUD, and occasional indigestion. Some of those medications include very common over-the-counter drugs that we use all the time, which is Tums, and Tums is calcium carbonate, magnesium hydroxide, which is milk of magnesium, and aluminum hydroxide, magnesium hydroxide combination, which is Maalox. So how does those medications work, and what is the reason that GERD happens or PUD happens? So GERD and PUD is basically, let's talk about GERD first. So GERD is attributed mostly to the unhealthy lifestyles, like eating a lot of fatty food, smoking, drinking, eating and then sleeping without giving any chance for any kind of activity, or staying at least 2 or 3 hours before going to sleep after eating, eating fatty food, unhealthy food. All those stuff play a very big factor. So one of the ways to treat GERD, and GERD is basically those gastric fluids which are acidic in nature. They travel up the esophagus, and a lot of people can even feel it in their throat. And what happens is that when this acid fluid from the stomach gets up through the esophagus, it causes the esophagus irritation. Continuous irritation can lead to progression of or initiation of some cancers in the esophagus. It also can cause constriction of the esophagus tube and difficulty in swallowing. So a lot of bad things can happen because of that. The peptic ulcer disease is caused by could be related to drugs like NSAIDs taken on an empty stomach. They can eat the mucosal membrane, or if they eat the mucosal membrane, then they start eating those mucous cells itself, and that's like an ulcer. So an ulcer is basically a wound, so that causes a wound. There are other reasons for that too. Stress ulcers too, due to a lot of stress. So there's so many reasons why those ulcers can happen. One of the methods to treat those ulcers, there's so many other methods, is to control the acid content. And so if you reduce the amount of acid in the stomach, this can help reduce the extra inflammation that can happen because of GERD and because of the peptic ulcer. So the first thing we use, one of the first group of medication we use to treat that are the antacids, and they work by a chemical reaction. So acids in the stomach reacts with those medications, which are all bases, and they neutralize the acid. So when they neutralize the acid, there's less of the irritation that happens due to the reflux, and there's also less of the irritation of the mucosal membranes due to the acid content in the stomach. Side effects include constipation or diarrhea, and the reason for that is that some of those medications actually cause diarrhea, others cause constipation. A good example of that, magnesium hydroxide, the magnesium components, they cause diarrhea. The calcium carbonate and aluminum hydroxide, they can cause constipation. So basically, on which antacid they are using, the side effects will be related to it. The second type of medication that's related to the digestive system too, and they're all over the counter also, with the exception of one, is the antidiarrheal agents. So when we have diarrhea or we know that someone has diarrhea, what do we give them? We give them bismuth subsalicylate, which is Pepto-Bismol. I mean, I think it's in every house, and we know how to use it. We also have diphenxylate, atropine, which is Dolomital. This is the only prescription one, and it's Schedule 5. And then the last one is loperamide, which is Imodium, and that's an over-the-counter drug too. What are the side effects of those medications? Well, it could be very clear that the adverse drug reaction of those medications that treat diarrhea, if they are given in excess or not really well controlled, they can cause the opposite, which is constipation. After that, we go into a different class of medications that treat gases, intestinal gases, and those are also over-the-counter medications. Those medications are used for adults and used for pediatrics. Some of those medications include simethicone, which is Gas-X. It includes also activated charcoal. Those medications are used to treat or relieve gases. Activated charcoal acts by basically absorbing the gases, as charcoal has an absorption character, and therefore it helps reduce those gases and relieve that kind of unpleasant feeling of flatulence. What they can do as a side effect, they can cause nausea, they can cause vomiting, and they can also cause diarrhea. With the fourth type of medication that we have today that affects the digestive system is the anti-inflammatory drugs for the GI tract. They are the 5-aminosalicylates. And they are indicated for ulcerative colitis, for Crohn's disease. And ulcerative colitis, from its name, is ulcers in the colon, basically wounds and inflammation in the colon. Crohn's disease is very similar to it. Usually Crohn's disease, they are actually related to hereditary factors. Ulcerative colitis can be basically related to a lot of other factors, stress, medications, and some other stuff that can cause the ulcerative colitis. And it's basically inflammation in the colon that causes diarrhea, and that also causes a lot of other symptoms, which are pain, diarrhea, and a lot of discomfort in the intestines. It can also really be severe to the point that the patient is not able to absorb the required nutrients because of these ulcerations, and can lead to malnutrition as a result of that too. The medications that we usually use from that group is they are derivatives of 5-aminosalicylates, which includes balasalazide, mesalamine, and sulfasalazine. Those medications, as you can see, they all have the root of sala. So let's say them again: balsalazide, mesalamine, and sulfasalazine. So the sala is the root for all those medications. What they can do is they can cause, as a side effect, they can cause muscle and joint pain, stiffness, nausea, and vomiting. The next medications that we're gonna look at today is the anti-nausea medications. And from its name, those are medications that are used to treat nausea and vomiting, or also motion sickness. Some of the common medications in that group include hydroxyzine, which is Atarax. It is an antihistaminic, and it's also used for motion sickness. Meclizine, the same thing, is an antihistaminic and used to treat motion sickness too. Metoclopramide, Reglan, is very commonly used in hospitals together with the Zofran. Zofran can be used in outpatient pharmacies and in hospitals too a lot. Prochlorperazine, which is Combazine, and it's one of the antipsychotics that has an antiemetic effect too, so it's mostly used in hospitals too. Promethazine or Phenergan is an antihistaminic that also has an antiemetic properties. Scopolamine too, which is those are patches placed behind the ears that help reduce the sensation of nausea and vomiting. There are other medications too, like aprepitant, which is Emend, and usually those medications are used for cancer patients before their chemo treatment. As you all know, the chemo medications, they are very highly they're very big reasons for nausea and vomiting, and they have a great emetic effect, so we usually give antiemetics prior to the chemotherapy dose. The last one that we're gonna group of medications that we're gonna talk about today, which belongs to the digestive system, are the digestive enzymes. Some people are born with deficiencies in the digestive enzymes, so the way to treat that is that we supplement them with digestive enzymes from outside. Some of those digestive enzymes includes lactase. The brand name is Lactaid, and those are those enzymes are responsible for digesting lactose, which is also present in the milk. So people who have lactose intolerance, they cannot digest the lactose in the milk, and usually cause them flatulence, pain, diarrhea. So those individuals, if they have this kind of deficiency, we can give them the Lactaid enzymes as a supplement, and they'll be able to use or utilize those lactose digest lactose efficiently without any of those side effects. The other type of enzymes that can be deficient to in some individuals are the pancreatase enzymes. And those are the enzymes that are used to, they are produced in the pancreas, and they are used to digest fats. This basically, one of the brand names of those enzymes is Creon, and we give it to individuals who have basically deficiencies on those pancreatase enzymes, are not able to digest fatty food. And when this happens, they also have severe pain, they have fatty stools, and it's really very annoying. So we give them pancreatipases, which is the Creon or any other brand of that includes pancreatipases as a component for them, so they can help them digest the fatty acids and oils. With this, we end our session for today. And if you have any questions, as usual, please text me on the website, email me on our website or through the YouTube or TikTok, and I'll be more than happy to answer any of your questions. And have all a great rest of your day, while aiming to see you soon with our 8th lecture. Thank you very much. Have a good night.